High cholesterol is one of the easiest health problems to prevent, yet millions ignore it until it causes a heart attack. In this video, we'll cover what high cholesterol is, what causes it, warning signs, how to lower it naturally, and when to see a doctor. Let's get started. What is high cholesterol? Cholesterol is a type of fat that our body needs to build cells and make certain hormones. It travels through our bloodstream in small packages called lipoproteins. There are two main types of lipoproteins, low-density lipoprotein or LDL and high-density lipoprotein or HDL. LDL is what we call the bad cholesterol because high levels of it can lead to a buildup of plaque in our arteries. This buildup narrows the arteries and makes them less elastic, which increases the risk of heart attack, stroke, and other health problems. HDL, on the other hand, is the good cholesterol because it helps remove LDL from our bloodstream. It also acts as an antioxidant, preventing the oxidation of LDL, which would otherwise promote plaque formation. Our liver produces most of the cholesterol in our body, but we also get some from the foods we eat. The recommended amount of total cholesterol in our blood is less than 200 milligrams per deciliter, or less than 5.2 millimoles per liter. If our total cholesterol level goes above this amount, we are considered to have high cholesterol. But it's important to remember that not all cholesterol is bad. High levels of HDL cholesterol, for example, may offer some protection against heart disease. That's why doctors often look at the ratio between LDL and HDL cholesterol when assessing a person's risk for heart disease. Ideally, this ratio should be less than 3 to 5. For example, if your total cholesterol is 240 milligrams per deciliter and your HDL cholesterol is 60 milligrams per deciliter, then your LDL cholesterol would be 180 milligrams per deciliter, which is above the recommended limit. In this case, your LDL to HDL ratio would be 3, which is in the ideal range. But if your HDL cholesterol was only 30 milligrams per deciliter, then your LDL cholesterol would be 210 milligrams per deciliter. And your LDL to L ratio would be 7, which is too high. So having high levels of both LDL and HDL cholesterol can increase a person's risk for heart disease. Causes of high cholesterol. High cholesterol is often caused by eating too many fried and processed foods, which are high in saturated and trans fats. Saturated fats are found in foods such as butter, cream, unskimmed milk, lard, and processed meats, while trans fats are found in margarine, fried foods, and some baked goods. These types of fats raise the levels of LDL cholesterol in the blood, which can lead to a buildup of plaque in the arteries. Other causes of high cholesterol include lack of exercise, smoking, alcohol consumption, obesity, and genetics. Warning signs of high cholesterol. Many people with high cholesterol do not experience any symptoms at all. However, there are some possible clues that can indicate high cholesterol. These include chest pain or discomfort, shortness of breath, and the presence of yellowish deposits near the eyes called xanthomas. Chest pain or discomfort occurs when the heart does not receive enough blood and oxygen. This can happen when the arteries are narrowed by plaque, which can cause the heart to beat faster or harder than usual. Shortness of breath can also occur when the lungs cannot get enough oxygen because the arteries that supply them with blood are narrowed by plaque. Xanthomas are small, harmless bumps that appear on the skin around the eyelids and may indicate a buildup of cholesterol in the blood. How to lower cholesterol naturally. Making simple lifestyle changes can help lower cholesterol levels and reduce the risk of heart disease. One way to lower cholesterol is by eating more fiber. Fiber binds to cholesterol in the digestive tract and prevents its absorption into the bloodstream. Foods that are high in fiber include oats, beans, fruits, and vegetables. Another way to lower cholesterol is by including healthy fats in your diet. Healthy fats like those found in olive oil, avocado, and nuts can help lower LDL cholesterol while raising HDL cholesterol. In addition to making dietary changes, it's also important to reduce the intake of saturated and trans fats. As mentioned earlier, these types of fats can raise LDL cholesterol levels and contribute to plaque buildup in the arteries. To reduce saturated and trans fats, avoid fried and processed foods, including fast food and packaged snacks. Instead, cook meals at home using fresh ingredients and choose healthier cooking methods such as baking, grilling, or broiling. Regular exercise can also help lower cholesterol levels. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise can help increase HDL cholesterol levels and reduce LDL cholesterol levels. In addition to diet and exercise, maintaining a healthy weight can also help lower cholesterol levels. Obesity is a risk factor for high cholesterol, so losing even a small amount of weight can make a difference. When to see a doctor, it's important to see your doctor regularly to check your cholesterol levels, especially if you have a family history of high cholesterol or heart disease. According to the American Heart Association, adults who are at increased risk for heart disease should get their cholesterol checked at least every 2 years. Those who are at average risk should get their cholesterol checked at least every 5 years. Starting at age 20, if you have high cholesterol, your doctor may also recommend other tests, such as a coronary artery calcium score, which measures the amount of calcium in the coronary arteries. This test can help determine the risk of heart disease and guide treatment decisions. In addition, people with high cholesterol may need to see a specialist in lipid disorders called a clinical lipidologist. A clinical lipidologist is a doctor who has completed specialized training in the diagnosis and treatment of lipid disorders, including high cholesterol. Clinical lipidologists can help people with high cholesterol develop a treatment plan that may include lifestyle changes, medication, or both. In conclusion, high cholesterol is a common problem that can lead to serious health issues if left untreated. By understanding what causes high cholesterol, being aware of the warning signs, and making simple lifestyle changes, you can keep your cholesterol levels in check and reduce your risk of developing heart disease. Remember, your heart health is in your hands. The small changes you make today can save your life tomorrow. Thank you for watching. If you enjoyed this video, please like and share it with others who might benefit. And don't forget to subscribe for more health tips and information. Stay healthy and take care of your heart.